our pelvis. So just with the pelvis itself, you have the bones, but I'm going to flash you, I'm sorry, just with the device here. But we have 3 layers of muscles in our pelvic floor. Typically when we are like 5 exits from the nearest exit on the interstate, right, we start holding things tight. So we may start just tightening the outside. And then once we actually start tightening everything, it's this layer underneath. It's what holds our organs in place, right? It keeps everything in. It actually holds babies in as well. I mean, it holds everything in. We are remarkably made, right? As women, we truly are superheroes in that our bodies go through every kind of anything, and we bounce back and still walk and take care of babies and husbands and dogs and cats and continue functioning with a smile on our face, because that's how we do things, right? But when we have issues with these muscles, it can pull us out of alignment. It can really change and affect how our bodies feel. If we're walking, we have pain on one side versus the other, it can really change so many different dynamics. We may think we're having back pain, but it's actually a side joint pain. We may think we're having a side joint pain, but it's a combination of so many different complexities back here. If we're tight on one side versus the other, when we go to hold, we won't be able to activate because one side is getting one signal and the other side is getting a different signal. So being able to look and see what the muscles are doing really makes a big difference. The pelvic floor itself provides support to the pelvis so the organs don't fall out, right? If you've ever had a history of prolapse or anything like that, that's something I work with as well. But sometimes it's a lack of coordination of those muscles and then our breathing patterns that can really change all those different things. And being able to gain control of that makes a huge difference. It also functions to allow urine and stool to leave the body or stay in until you're ready to void, right? It allows for normal sexual function, stabilizes the trunk, and it actually acts, when we take a deep breath, our diaphragm moves, right? This muscle group moves like a diaphragm as well. And so we have lymphatic tissue within our belly, right? Our lymph nodes and everything else like that. The diaphragm as well as the pelvic floor act together to shift fluid around throughout the day. So it actually aids in our health that we have a healthy pelvic floor, because not only can we keep our organs in, but then we can keep them healthy by shifting and moving that fluid around like we need it to, right? So being able to look and see, if you have a history of a pelvic floor dysfunction or you have no idea that you do, don't worry. We have someone on staff who can help as well. But today we're going to kind of look and see and start stabilizing and moving in different ways. And if you have some issues that you notice that you've been having, don't worry, we have staff here that can definitely help you with that. So if you know of something that's already been identified, let us know, we're here for you. A typical dysfunction that you may be looking for could be incontinence of bowels or bladder, difficulty initiating your urine stream. If you have so much tightness there from trauma, maybe you fell off a horse or a bike handle just hit just perfectly, right? Skiing is always a fun incident where you can fall just perfectly and mess something up too. If you have difficulty emptying your bladder or bowels, or after you void, you feel like something still needs to go, that could be considered a pelvic floor dysfunction as well. If you have increased pressure in that area, like a pelvic prolapse, that can happen just because of decreased coordination of those muscles. And then if you have low back pain, that can mask as a pelvic floor dysfunction. Hip pain, pelvic pain, if you have difficulty inserting a tampon, or even when you go to have an exam from a doctor and everything is painful, that's a sign of a dysfunction as well. If intercourse is painful, I mean, things that we should naturally enjoy in life, if anything that is happening to your body is painful in that area, most likely it's associated with some issue to the pelvic floor. So if you're thinking if you have any of those symptoms, talk to one of us afterwards. We can dive in a little bit deeper and maybe set you up to see one of us one-on-one to be able to kind of help restore normal movement patterns and even that control that you may or may not be lacking, right? Being able to get all those different things going. But as far as the pelvic floor goes, it is amazing how often it gets neglected because it's something we've never had to think about before, right? So we will talk today about the SI joint and getting your alignment and getting your hips going, but oftentimes it's those muscles that are pulling in ways that we didn't even know were possible, and being able to release those and find them really makes all the difference. Okay? I'm going to pass this back over